Hello. It's wonderful to see you again. Just remind me, you're a little bit early for your physical exam this year. When did you come in last? That's correct. So you're actually not due another physical exam for a few months yet. Oh, I see. You're going away for work. Right, I understand. Well, that makes perfect sense then. You want to make sure that you're in tip-top health before you go away. No, I totally understand. That's fine. So just allow me to pull up your record here. Okay, have you been feeling okay since I last saw you? Oh, well, you look just wonderful as always. Very healthy and with lots of vitality and energy. Alright, so can I just get you to confirm your name and date of birth? That's perfect. Right, so let's do the pre-examination questions first. Any current medications that you're taking at the moment, are they the same as what you were taking last time, or have any of those changed? Right. Okay, let me make a note here. Okay. And are you taking any new medications? Oh, is that a over-the-counter supplement? What's the brand of that, if you don't mind me asking? Oh, I see. And have you noticed a change taking that? And how long have you been taking that for? Okay, that's fine. No. Are you experiencing any pain or any symptoms that you are concerned about right now? So you'd say that you're in general good health. That's perfect. So I don't see any recent tests. Have you done any at-home tests that we should be aware of, such as allergy tests, at-home blood tests? Basically, any tests that you can order online which don't go through your GP. Okay, and when did you take that? And what was the result? So, nothing you want us to look into. Alright. Any family medical history that needs to be updated? So that's any recent family diagnosis of heart disease, cancer, glaucoma, high blood pressure, or any other diseases or symptoms that you may think is relevant. Okay, so that was on your father's side. Now, recently was that? I see, that correlates to what we already have. So I think what I would need to do for you is have you booked in for an ECG just to make sure that your heart is functioning how it should. There's nothing to worry about. This is just precaution. As you have a strong family history of heart-related problems. This is just cautionary for you, as this tends to run in families. So we really want to keep an eye on you and catch anything early should it present itself. Would that be okay? Wonderful. So I can schedule you in for next week actually. You'll get a letter through the post, or unless you want to opt out of post and just have it through your email and text. Okay, I'll opt you out of post. It's normally a lot quicker doing it through email and text anyway, so you'll get a text reminder and an email reminder. You can pick the time that you'd like to come in for that. Normally we have very good availability, but should it not work for you, then please do give us a call. We can reschedule it for another day. So no major or minor surgery since your last visit. No visits to the emergency room. Any other illnesses this year that you can remember having? Any cold, flu, viral infections? No? Any changes to your diet since your last visit? Has your consumption of alcohol changed since your last visit? Alright, you don't smoke? And how often do you exercise? And what kind of exercise is that? Alright, well, that is perfect. Let's just sign this off here. Great. So, are you alright with me performing the physical aspect of the examination today? Perfect. So first things first, let's start with your heart, seeing as that is our primary cause for concern today. So just sit normally, just relax. Try not to worry too much. Sometimes with these examinations, your heart rate and blood pressure can elevate slightly just because of nerves, and that's understandable. But please try to relax. I'm going to listen to your heart. You can close your eyes if you wish. Good. Just going to move this up to your neck here. Have a listen to the pulse in your neck. Alright. Okay. Good, you can relax. So your pulse was a little bit elevated, but honestly there's nothing to worry about in that regard. I think it's just the nervousness that you might be feeling visiting us today. It's very, very common, nothing to worry about. And like I say, the ECG should be able to rule out anything that presents itself, and we can have a further look into what's going on. Alright, so lungs now. You said last time that you had a little bit of a respiratory infection. How's your breathing been since then? And what's it like when you exert yourself? Right, that's fine. Let's have a little listen then. Just breathe normally for me. All right. Now take a deep breath in. Out. Good. Deep breath in. And out. Good. Now deep breath in and hold. And release. Deep breath in. Hold. And release. Okay. So lung capacity is normal. I think that viral infection cleared itself up very nicely. So, can I get you to now stand just behind you, up against the height chart there? Let's check your height. Okay. Oh, just while you're there, could you just pop on the scales there for me, please? Just calibrate this with my app. Yes, it all goes onto the app these days. It's very handy. Okay. Yes, you can come off there now. It looks like you've lost a little bit of weight, but I think that's probably to do with your changes in exercise routine. Right, so it's intentional weight loss. Alright, that's fine. So your BMI is perfect. Wonderful. Now let's check your blood pressure. Alright, so let's put this cuff on you here. Does that feel alright? Okay, good. Let's put my stethoscope here. Alright, just a little bit of pressure here. Okay, good. Okay. All right. So your blood pressure does seem a little bit elevated, but it's honestly nothing to worry about. I think it is a case of the white coat syndrome again. All right. Okay. That's perfect. So, let's have a little look at your hair, skin and nails. Any changes that you've perceived since the last time I saw you? Well, that happens to us all as we get a little older, right? Alright, let's start with your hands then. Have you noticed any changes to your nails? The strength of your nails? Or any changes around the cuticle area? Okay, just turn your hands over for me. What about sweaty palms? Any changes to how much sweat your hands produce? Alright, let's have a look at your skin. Any changes that you have noticed in terms of oil production? Any breakouts, dry patches, redness, or any noticeable scarring? Alright. And your hair? Yes. So you're a little bit concerned about your hair thinning. Alright. Well, there's a brilliant trichologist who'll be able to have a look at that just to determine if there's any underlying reasons why your hair is thinning, or if it's just simply wear and tear and the fact that you are getting a little bit older. I can refer you to them if you would like. That's absolutely fine. We can schedule you an appointment when you get back. That's not a problem. So, now we've done your blood pressure, we've inspected your hair, skin, and nails. It's time to have a look at your eyes. So, when was the last time you visited your optician? Had your eyes tested? Okay. And just remind me, you wear contact lenses? Oh, I see. Right. So would you say that you exclusively wear your contact lenses when you are doing your sport, and then you wear your glasses consistently throughout the day? Right, and how long do you wear your contacts for? And do they cause any redness or irritation? Alright, I would suggest going back to your optician and speaking to them about it. It seems like they might have to change the prescription or change the actual contacts themselves if you're having trouble with them. Alright, but for now, I'm going to take a little look inside your eyes. Just at surface level. And I can have a look at this redness that you've been telling me about. It doesn't look like your eyes are red at the moment, but they're a little bit sore. Alright, no worries. Just look straight ahead for me. Just look over my shoulder. Look up. Look down. Side to side. Okay. So I don't see any visible redness, but if you're experiencing pain in the eyes, then I'd definitely go to see your optician as soon as possible. It may be something to do with your contact lenses or even your prescription. I can't see any signs of infection, inflammation, or anything that's a cause for concern, but yes, make an appointment as soon as possible. So I'm just going to check your pupil dilation now. Just look straight at me. Good. 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 Look up. Look down. Look side to side. Okay, good. Now could you just follow the tip of my light with your eyes, keeping your head nice and still. Good. 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 That's very good. Okay. Could you tell me which finger is wiggling? Perfect. 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 How many fingers am I holding up? Good. 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 Perfect. So, your eyes seem to be, well, besides the irritation and pain that you've said that you've been experiencing, everything else seems to be working perfectly. So, now I'd like to just take a little look inside of your ears. Now, please remind me, when was the last time you had a hearing test? So that was quite some time ago then. Have you noticed any changes to your hearing? Or have any of your friends or family said that your hearing has gotten worse? Okay. Would you say that it's mostly when you're in crowded situations rather than where we are now, like one-to-one? Yeah. And would you say that it has a negative impact on your life? Alright, well that's not too bad then. I would say yes, it would be good to schedule a hearing test. They're very quick and simple, it's very straightforward and comprehensive, and you tend to get the results the same day as well. Yes, I think you should do that as well when you get back. Yes, lots of tests to do, but your job doesn't involve being able to hear crystal clear, right? Oh, well, lucky you. That sounds amazing. Alright, no, that's fine. So let's take a little look in your ears here. Have you noticed any changes to earwax production? Right. Oh, this one's looking a little clogged. Maybe a correlation. Yes, you might be right. Looks like you have a little bit of scarring on this eardrum, but unless you're feeling any pain in that ear, then I don't think it's anything to worry about. So yes, I think that your left ear is what's causing that slight change in your hearing. You know what I'm going to say, don't you? Yes, I think some ear cleaning is in store for you. Yes, a very good question actually. I do believe that the hearing assessment clinic does offer ear cleaning as part of their package. Yes, I would recommend booking both at the same time. Alright, perfect. So, now let's have a little look at your sense of smell. Now, any changes to your sense of smell or taste since last time? No, that's absolutely fine. So, I have 2 vials here. I want you to occlude one nostril and tell me what you can smell. It's perfect. And occlude the other nostril. And tell me what you can smell now. That's perfect. Okay. Could you just open your mouth and say, ah? Okay, stick your tongue out. Just give the tongue a slight little wiggle. And close. Swallow for me. And cough. Good. Now open your mouth again and say ah. Perfect. Now let's take a little feel of your jaw here. I remember last time you said you had a little bit of trouble with grinding. How is that now? Oh, perfect. Yeah, they really do help, don't they? And just open your mouth. Close. Good. Okay. So let me have a little feel of your neck here. Okay. And swallow. Okay, good. Perfect. I'm just going to be palpating your stomach now. Remember last time it was IBS, right? It's still having symptoms. Did we refer you for an endoscopy? That's right, I see. Yeah. And it confirmed it was IBS. Okay, no, that's okay. Great. No pain? Okay. Perfect. Now if you can just take my hand, give it a little squeeze. And the other hand. That's perfect. Alright, so that brings us to the end of your annual physical exam. I'm going to send you off for a blood test as we do every year. I want you to have that as soon as physically possible, as soon as your schedule allows, to allow time for the results to come back before you go away. Would that be okay? Great. And then when you get back, I would like to follow up with you over the phone to book in for those extra examinations that we spoke about. Alright. Well, it's been lovely to see you as always, and good luck with your job, and I look forward to seeing you again soon. Alright. See you later.